Hello everyone, my name is Dr. Oliver Crocco, and this is Module 5, Diversity Intelligence, Intercultural Competence, and Effective Communication. Hello everyone, welcome to this week's module. I'm here with a very special guest at the University Forum for Human Resource Development in Nottingham, England. This is a conference, an annual conference that is in the UK one year and then in a different European country on the opposite year. So it's here in the UK now, and I just was in a fantastic presentation by Erica McMullen, who works for Moxie Consulting Group, founded Moxie Consulting Group after working as a human resource specialist in diversity and inclusion for many years and works in healthcare. And her presentation was great, and it was on the supervisor's point of view about mentoring relationships. And I thought this would be fantastic to have her in this week's short video. Just so I'm going to ask her, please, if you wouldn't mind, Erica, just tell us a little about yourself and your experience. We'd love to get to know you more.
Absolutely. So as Ozzy said, my name is Erica McMullen, and I spent the last 20 years in the healthcare field. And right now what I'm focused on is helping people create effective teams and helping people create diverse and inclusive workplaces. I'm also currently a graduate student at the George Washington University in Washington, D.C.
Fantastic. And tell us about, so this week's topic for this module is diversity intelligence, intercultural competence, and effective communication. So has there ever been a program you've run or a challenge you've faced or a model that you've used that really helps you to do your work or understand those concepts in your work?
Yes, so models that I like to use, and specifically I think within healthcare, the goal to achieve cultural competence and being able to deliver culturally competent care is really critical. We talk about that and being able to eliminate health disparities. We talk about that and being able to foster better patient-physician relationships and communication, right? That's huge in healthcare. And so, for instance, if you look at Terry Cross's model, which came out years and years ago, but that's still a really great model in moving people from this idea of sometimes cultural destructiveness or cultural blindness to an idea of cultural competency. Although sometimes I feel cultural competency can be a misnomer. And the reason is because people assume that once you become competent in something, you master something. But I think it's really important to think of culture as something that can't be mastered. Because culture is always evolving, and you never really master understanding culture. You never really master understanding somebody else. So another term I really like is cultural humility. And so it's the idea that you're always humble, you're always learning, you recognize the difference in power between people, you recognize the ability to always learn. And I know in my career, even vocabulary has changed, right? So how we approach certain things and the words that we use, completely different than what it was even 5-10 years ago. And so I think that's an important piece of it. And then there's other really specific, I would say, nursing models that have come out with culturally competent care that I like to use. Larry Purnell's a good one. The Sunrise Enabler model by Madeline Lenher is another good model. But it's all at the idea that it's this idea that you recognize all of the different diversity dimensions of individuals, and you don't say that it's good or it's bad. You recognize it, and then you say, okay, you know what, this is what is on the table, and so how do we move forward in recognizing what's there and being able to meet patients' needs and experience within a hospital. You don't leave those diversity dimensions at the door. You don't take your religion off when you walk in a door. You don't take your sexual orientation off when you walk in a door. And so all of those are components of who you are. And I think many times you walk into healthcare organizations and they pretty much want you to conform to something that you're not. Right, so there's one way to do it, there's one way to do it right, this is how every patient should follow it, but we're recognizing more and more the importance of that within a holistic healthcare system.
Thank you very much for sharing that. That's excellent. And I will share those models that she mentions with you all. Just one last question. How do you deal with pushback, with people who don't get it, who are frustrated, who are misunderstanding, and who perhaps already feel that they are competent and that they've arrived, that they don't have that humility that you mentioned? How do you handle that in an organization?
And I think it's important to, instead of, I would say, trying to have the individual like see your point of view, because in a way you're then doing the same thing. Like, I'm right, you're wrong, right? That kind of, you get into ego and defensiveness, is really to say, how can we work together to best solve this problem at hand? And so when you kind of engage them from that approach, because they're coming to you, they're frustrated about something that doesn't feel right to them, or something that they don't understand. And so because they don't understand it, they're like, those people, or that. And so it's like, well, what are we trying to accomplish? Or it's not who is right? It becomes, what is the right thing to do? And so I feel like that has been really critical, because once I get into I'm right and you're wrong because I feel right and you feel right, we accomplish nothing. But if we can almost put that aside and say, okay, what's the right thing to do? Right? We may not understand, perhaps, why this patient doesn't want this procedure. We may not agree that, this patient is doing X, Y, Z, but what is the right thing to do for them? And then, in adult medicine, it's a little easier because they have free agency of themselves. In pediatrics, it's, even a little bit more complicated, which is where I spend a lot of my time, because you have the patient who's not of age and then the parent. But I think that approach sometimes can really make a huge difference. And I feel like it changes your communication. So if you are in meetings or committees and all you're talking about is defending your point of view, it's really difficult to move forward. So I think that's how you can also look at cultural competency and diversity and communication together.
Awesome. Thank you so
You're
much,
so
Erica.
welcome.
I'm so
Thank
glad
you.
that you could sit here and you were willing to give us your time to learn from your experience. I really appreciate it. And in the future, I hope some of you will also think about coming to one of these conferences. They're going to have the LHRD conference in Atlanta, Georgia in February next. So thank you very much. Thank you. All right. Bye-bye. I hope you enjoy this module, and I'm looking forward to reading your cross-cultural experience reflection papers.